Dr. Jessica Ilani, and I'll be discussing with you in this video how to make a diagnosis of tension type headache. Tension type headache is a primary headache disorder, which is the most prevalent neurological disorder worldwide. The diagnosis of tension type headache is made based on criteria from the International Headache Classification of Headache Disorders, version 3. ICHD-3 criteria for tension type headache subdivides tension type headache into 3 categories based on headache frequency. Episodic tension type headache is less than 1 day a month on average or less than 12 days a year. Frequent episodic tension type headache is between 1 to 14 days a month or between greater than 12 and less than 180 days per year. Chronic tension type headache is having headaches for greater than 15 days a month or greater than 180 days per year. Both types of episodic tension type headache have a duration of greater than 30 minutes to 7 days, while chronic tension type headache has a duration of hours to days or is unremitting. Clinical features include at least 2 of the following 4 pain characteristics: bilateral location, pressing or tightening quality, mild or moderate intensity, not aggravated by routine physical activity. For those with episodic tension type headache, there should be no nausea or vomiting associated with the headache, but they may have either photophobia or phonophobia, though this is not required. For those with chronic tension type headache, they may have either photophobia, phonophobia, or mild nausea associated with headache. The diagnosis of tension type headache is reached by detailed history of patient symptoms and a normal neurological examination, and excludes secondary headaches. Use of headache diary may help in diagnosis of tension type headache. In the patient history, tension type headaches are often described as long-lasting, more often bilateral, pressure-like in nature. They're often described by patients like a cap around their head or a band-like sensation. Some patients with tension type headache may report tenderness of their head, neck, or shoulder muscles. Triggers can exist for some patients, with stress being the most common, followed by sleep changes. Despite tension type headache being mild to moderate in intensity, up to 60% of people may describe impaired social activities and working ability. It is important to note that while people with episodic tension type headache rely mainly on home remedies and over-the-counter treatment for relief of symptoms, those with chronic tension type headache are more disabled from symptoms and may seek medical attention. Special attention should be made to medication overuse headache and other headache red flags that may indicate a secondary disorder. These include headaches that are sudden in onset, progressively worsening in time, brought on by sneezing, coughing, or exercise, headaches brought on by head trauma, headaches associated with weight loss or change in memory or personality, headaches associated with focal neurological signs or symptoms, headaches starting in the age of 50 greater than 50, headaches associated with a stiff neck, unexplained fever, headaches worsening with change in position or Valsalva. If headache red flags are present, consider neuroimaging to rule out a secondary disorder.